All right, good afternoon, everyone. Thank you very much for joining our Whatcom County COVID-19 Vaccine Readiness Town Hall. I'm Chuck Prosper, I'm the Chief Executive for Peace Health in the Northwest Network. And I really just want to extend not only welcome to all of our participants who are at home or at work, but also I want to extend great gratitude to our panelists who are actually going to serve as subject matter experts, providing you the latest information on where we are with COVID-19 vaccine readiness. Next slide, please. So this is the agenda that we will be covering today. And recognizing that this is a Teams live event, there are certain functions that do not exist if you're used to Teams or Zoom or other meetings. There isn't a live chat function. We have actually received a number of questions in advance, and so we'll be referring to those questions in our Q&A section. So if you are trying to chat or ask a question, unfortunately, that's not an option for this meeting format. But our goal today is to really speak to the current state of COVID-19 in our community with a focus on vaccine eligibility, availability, and distribution. A lot has happened in Washington State this week with the kickoff of the governor's announcement at the beginning of the week on Monday to really announce that we're moving into a new phase, a phase 1B1, that really expands the number of individuals eligible to receive vaccines. So we're going to do our best to answer those questions. We're also going to be able to address vaccine safety and efficacy, and then answer your questions. What I want to do, though, and just acknowledge as we, next slide, please. There we go. So this is, while Peace Health is hosting this meeting today, this is certainly not a Peace Health effort. And so I just would like you all to take a moment to take a look at the names and the organizations who are represented on our call today. We will move at a fairly slow and deliberate pace so we as individuals are able to answer questions and speak to some of these topics from our own individual perspectives. And it may be that for the first opportunity where we have that moment for all of us to give an update, I'll go through a little bit of a roll call so that our producer can help get the right person queued up at the right time. But for all of our leaders from Family Care Network, from CMAR, from the Peace Health Medical Group, and the Whatcom County Health Department, I want to extend a sincere expression of gratitude. Next slide, please. So I want to highlight for you where we are for Whatcom County in terms of COVID-19. Across the county, we've had a little under 5,000 total confirmed cases. We've had 236 hospitalizations, and we've had the loss of 56 individuals to COVID in our county. And while that is a very small percentage of deaths compared to total cases, it's still significant, and I don't want to understate that in any way. The standard of excellence test, the PCR test, indicates that we've actually had 137,000 individuals in Whatcom County tested for COVID. And I know that some of you might have been tested more than once because this is a disease where testing and knowledge about your results is such an important part of not only diagnosis, but contact tracing and prevention of further spread. Let's go on to the next slide, please. So this is a Peace Health vaccine snapshot, and after I go through some of the data, I'll have an opportunity to ask our other participants about their organization's vaccine experience. So inside Peace Health, especially at the hospital, I think we've really benefited from being a healthcare institution, a hospital entity, having a vast number of 1A workers, which were in the first phase. Our caregivers and providers, individuals across our entire medical staff, were some of the earliest individuals available or ready for the vaccine. So we've actually vaccinated over 2,800 caregivers and providers. A good fraction of them are already on to their second dose. So we've been able to administer over 4,900 vaccines to date. I'd also like to recognize when it came to phase 1A, looking at community health workers, there was a tremendous partnership. And if I might just ask Dr. Boxler to tell a little bit about that story and how we've been able to reach community health workers with the medical group.
Yeah, Chuck, thanks for letting me speak on this. At the Peace Health Medical Group at our Cordata building, we used our pediatric expertise in giving vaccines to set up a program, and in cooperation with the health department, we're able to obtain the first vaccines that we were able to give. We started with our emergency responders and now have reached out to all other healthcare providers in our community, and so far have done about 1,400 vaccines through that clinic. That's been a 2-night and 1 weekend day clinic that we've been doing at Cordata. We are now moving over to the Health Education Center closer to the hospital, and we'll continue to finish out probably about 1,000 to 1,500 more 1A healthcare workers who we have on our lists that we're reaching out to and scheduling now. And it's been a great community effort because we did get the vaccines from both the health department and also Kaiser's Pharmacy, who did not plan on giving it, actually transferred some over. So many of these vaccines were not ones that the state allocated to us, but that we got transferred from others.
Thank you, Dr. Boxler. One of the themes that will really become evident as we talk today is the theme around collaboration and coordination within our community. If I might ask Dr. Ione Adams to speak next about some of the efforts underway at CMAR and what some of the vaccine experience has been as you've reached out to your community.
We have also had the opportunity to provide vaccinations for other healthcare workers in our county. Several physical therapy offices, dental offices contacted us, and we were able to have them come in office groups primarily to our clinic and receive their vaccination. We also received requests from the health care staff at Western Washington University, Planned Parenthood, Unity Care Northwest, and have been able to have our staff go to those facilities and provide vaccinations for their caregivers as well.
Thank you, Dr. Adams. And what I'd like to do, so thank you very much, Dr. Adams. What I'd like to do next is to take a moment and have Dr. Jim Hopper from Family Care Network give an update regarding their progress.
Thank you very much, Chuck. We've received approximately 1,000 vaccines from the state and have used those vaccines for the FCN staff, as well as some of our community 1A worker partners, bringing in some of them for specific vaccine clinics. We've been, waiting for more vaccine for more of that, but still working at what we have.
Thank you, Dr. Hopper. Really appreciate that update. So if we may go on to the next slide, please. Now, here comes the big pivot. We've been talking about 1A providers at this time, and these are healthcare workers at high risk for COVID-19 infection. And it also includes individuals who work in long-term care facilities, first responders, and all other workers in healthcare settings. There's still more work to be done in Whatcom County, and we continue to try to reach out to all of those individuals as vaccine supply allows. But we are also now, based on the state guidance, beginning to slowly change into readiness for our 1B1s. And 1B1 is individuals who are 65 and older, or people over 50 who live in a multi-generational household. Next slide, please. And so this is a fairly significant group in the state of, or in Whatcom County and the state of Washington. And so as you look at the screen, this gives a little bit more detail in terms of the definition. We anticipate this being in excess of 45,000 individuals. And with that comes a big lift, a big outreach effort, and at this moment, more demand than there is supply. So I'd like to start again with Dr. Boxler to talk a little bit about how Peace Health Medical Group is approaching reaching out to the 1B1 eligible patients.
So our first foray into that, Chuck, is going to be that we're going to be sending out email communications to all of our patients who meet that criteria, all our primary care panel patients. We are also working with our partners to make sure those patients who don't have primary care providers who are going to be able to give them the vaccine, that we can get them in as well, especially if they're being seen by some of our specialists. We'll have a variety of ways for people to schedule based on that, and we are starting our clinics for the 1B1 group actually today, and we hope to be ramping that up. But there is limited vaccine and limited availability, and we are also hiring new people to help us with this. So we're limited in every resource we need right now. So we are ramping that up as quickly as we can, and we'll be communicating with everyone as we're able to get people in.
Thank you very much, Dr. Boxler. So I'm just going to follow the same format, and thank you again, and then I'll move on to Dr. Ione Adams to give an update on CMAR's approach.
So we are also opening our doors and trying to get more people in to be vaccinated. I will reiterate what you've heard from everyone so far, that this is dependent on resources, our primary resource being the vaccine itself. And we don't, at this point in time, have enough information as to when we're going to receive vaccine or how much to be able to predict exactly how this will run. The CMAR website, for those of our patients and public who are interested, will be updated daily, and people may be aware that we have many CMAR clinics along the I-5 corridor, and so they will be posting on the website which clinics have vaccine available any given day and what the eligibility requirements are at that point in time. We are also going to be reaching out via our patient portal, potentially some phone calls, outgoing preferably, because again, our phone lines cannot handle everyone calling in. So we were asking people to go to the website, to wait for notification for us, or to check via the patient portal. And our goal is to vaccinate as many people as we can each day and each week, given the supply we have on hand. Thank you.
Thank you, Dr. Adams. Dr. Hopper, would you mind giving us an update on FCN's plans?
Thanks. We are also committed to being able to give vaccine to all of our patients in the appropriate tier. We also are really thankful for the patients so far in not overwhelming our phone lines. The process at Family Care Network, we will have dedicated vaccine delivery personnel in each of our clinics, and we are standing up a drive-through vaccine clinic. We'll be able to deliver about 2,700 vaccines weekly within the next 3 to 4 weeks. again, for us, the information for our patients is going to be found on our website, familycarenetwork.com. That will be updated daily or multiple times daily, dependent on availability of vaccine and open schedule slots. There will also be information there about scheduling for vaccine. Thank you.
Thank you, Dr. Hopper. And clearly the theme is do not call, go to the website. We really do need to protect all of our healthcare organizations, telephone lines and capacity in order to conduct the regular business. So those critical lines of communication we are trying to preserve for traditional healthcare, and then having COVID vaccination information being accessed electronically via a website. I would like to take an opportunity now to introduce Erica Lautenbach and Cindy Hollinsworth from Whatcom County Public Health Department, because I know that one of the big questions is where do we go next? And I really just want to reiterate our expression of gratitude and support from the county, and we certainly recognize that they have a very, very large task ahead of how do we all marshal our resources together to protect Whatcom County in its entirety. So if Erica or Cindy are available and would like to speak up, we'd love to hear from you.
Hi, this is Cindy Hollinsworth, and from the Whatcom County Health Department. I'm the Communicable Disease Manager, and I just want to send the message to the community that we're just working so closely together with all of our partners in the clinical arena to get people in for vaccination appointments. We are challenged, as you all know, from the national news and the state news with vaccine supply. So we know this is frustrating. People have been going through a great deal over the past year, and we're tired and we want to get vaccinated and put this behind us. But our community really is working together as quickly as we can to get shots into arms and to keep you informed. So, and Erica, I don't know if you were able to get on the call or not. Did you have anything else you wanted to add?
Oh, great. I am no longer muted. Good afternoon, everyone, and thank you for that, Cindy. There was a little bit of a technical issue, so I'm back. And I just want to share, I sent an email to staff this morning because it was exactly a year ago today that the first case in Washington State was identified, and our health department activated our incident command system. So it has been a long year, and like Cindy said, I know people are really anxious to be vaccinated. We are doing the best we can at the health department level to advocate for equitable distribution of vaccine, and this is obviously challenging statewide, and there's limited supply both state and federally, but we're doing our best to make sure that we can work with our partners, and as soon as more vaccine becomes available, we'll be ready, and we'll be coordinating with partners to make sure that we can get as many people vaccinated as possible.
Thank you so much, Erica. Okay, thank you again. Let's go on to the next slide. So we have two types of vaccines available in Whatcom County, the Moderna as well as the Pfizer vaccine. There's lots that you can research online about this. What I will say, though, is that our experience with both of these vaccines is that the scientific studies demonstrate that they are very effective. While there is a difference in terms of the Moderna and Pfizer vaccine, in terms of when you get your first dose and your second dose, either 4 weeks apart or 3 weeks apart, the efficacy is really shown to be very comparable in clinical trials. Next slide. And I know that some individuals are really concerned about vaccine reaction and what that will mean. And I can just share on behalf of Peace Health, our vaccine experience, the reactions have been very, very small in number and very minor. in severity. So at least our personal experience is that we've actually seen any post-vaccination side effects to be very minimal and very short in duration. What I'd like to do now, though, let's go to the next slide, please, is move us into our questions and answers period. And what I would like to do is just to really begin to talk a little bit about the distinction between someone who feels like they are qualified and that they believe that they're an essential worker, but it's not quite their time yet. And so I would like to offer perhaps to any of our provider out there, just by a show of hands, how you handle someone who might be very interested in a vaccine, but it's not quite yet their turn because their group has not been called out or called up yet. What would you offer as bits of advice for them in understanding that there is a process and what we would do when it is indeed their term? How about if I asked Dr. Hopper to help me out with that question?
Sure, thanks. Really, what I'd say is that we encourage people, though of course this is a scarce resource in great demand, and so there is a feeling that for some of us that it's every man for himself. But I think that the more we get the appropriate phases of vaccine recipients done, the more we're protecting the highest risk groups in our population. They're the people that the Department of Health has identified as our strategy for decreasing severe illness, hospitalizations, and deaths as fast as possible. So I try and use just that sort of logic with my patients when they ask, why can't I go first?
Thank you, Dr. Hopper. And while you're poised and ready to communicate, I think I might ask you a follow-up question. And we've had a number of questions about, well, gosh, when I get the vaccine, does that mean I have immunity? And how much immunity do I have on the first dose versus the second dose? And what levels of protection am I really receiving as I go through the vaccination process? And I'm wondering if you might address that for us, please.
Sure. There are a couple of types of answers to that question. Our immune system responds fairly readily, and the early indications are that by 2 weeks after the first dose, we have the beginnings of protection. That protection is no better than about 50% at 2 weeks after the first dose. Full protection is considered 2 to 3 weeks after the second dose. Full protection, based on the studies, being a 95% reduction of chance of developing an acute COVID illness. Now, so we can say that you're much less likely to get sick from COVID 2 to 3 weeks after your second dose. That doesn't mean, so far, that you can't transmit it. The studies have not shown yet, they haven't even been done, to see if you can carry the virus in your droplets even after you've been vaccinated. So it's remarkably important that all of us who have been vaccinated continue to follow the same guidelines of social distancing, masking, and hand hygiene. This is really not a get out of jail free card. There is still the chance of transmitting it. And so we will be in that same state for months and months.
Thank you very much, Dr. Hopper. I think that's a very important. I think it's a very important element to remember that all of the things that we are doing to protect ourselves today must remain a part of our life for quite some time until our community reaches that level of herd immunity where a sufficient number of us are protected and reduce transmission from individual to individual. I think that what that also means, though, is until we actually see COVID drop significantly in our county, we have to assume that it's still out there and still very, very dangerous. Dr. Adams, I'd like to pose the next question to you. And it's a question around the unique needs of agricultural workers, and how are we going to address their needs? So they're in an upcoming phase. They're absolutely essential. And knowing what we know about agricultural workers in our community, there might be some additional barriers and considerations. So I wonder if you could help us out with that question.
Absolutely. Many people may be aware that agricultural workers have long been a priority group for services from CMAR, and that includes COVID vaccination at this point in time. Historically, we have provided services both in our clinics and out in the migrant camps and the housing settings where a lot of the agricultural workers reside. We've done outreach flu shots, we've done summer outreach camps. We also have a very active group of promotoras that work with our agricultural workers and help us know where people are, what their needs are. For individuals who have been seen at CMAR clinics, that's one of the designations we use also in identifying our farm workers is they are registered as agricultural workers. So we are currently very actively starting to reach out to the camps and the areas where we know a lot of these workers are. We have a lot of staff who are bilingual in Spanish. We also share resources from county to county, and Skagit County has CMAR employees who speak Mixteco and a few of the other dialects. We're looking at having after hours and weekend clinics as well to reach our agricultural workers. So these are the approaches that we have used and anticipate using in the next few weeks and to follow. Thanks, Chuck.
Thank you so much. The next two questions I'd like to have Dr. Boxler address. The first one is related to pediatric clients, those who might be under 18 years of age, and whether pediatrics patients should be vaccinated.
So as of now, neither vaccine that's been approved has been approved for anyone under age 16. So we won't be able to vaccinate our younger children or even our adolescents until we actually have an FDA approved vaccine that's been shown to be safe and effective in those age groups, just like the Moderna and Pfizer vaccines have been shown to be safe and effective for older patients. I do know that both Pfizer and Moderna have started vaccine trials with their vaccines that are already approved for adolescents between the ages of 11 and 18. And I think Pfizer is also starting on a younger group that either goes down to age 5 or 1. I'm not sure which one. So we're very hopeful that by the end of the summer, there will be data back that will show that there is a way that we can safely vaccinate kids, but we also want to be very careful with our children because they're at lower risk for getting very sick from COVID. And we want to make sure that anything we do to prevent a fairly low risk illness in that age group does not cause any side effects. So the quick answer is nothing for kids yet, but that's being worked on, and we will have vaccines for kids, I'm sure, in the future.
Thank you, Dr. Boxler. There's one more question I'd like to ask you. And because you've had the opportunity to vaccinate a fairly large number of our population, what are some of the minor adverse reactions to the vaccines? What are some of the things you've observed in terms of post-vaccine reactions?
So in our vaccine clinics, the most common thing that we see is people getting nervous. People hyperventilating and feeling lightheaded, people actually starting to feel a little bit nauseated, and that's completely understandable. We have nurses and we actually have providers on site to talk with people, and so most of the immediate vaccine reactions that we're seeing in the clinics have been able to be taken care of by having people sit, breathe a little bit more slowly, give them a sip of water, maybe a little bit to eat. We have seen in our clinics, we have seen one person who's begun to have a fairly significant allergic reaction, and we were able to treat that immediately and get them stabilized, and they were better and back home after an observation period in the emergency room. But so that's immediate. What we're hearing from everybody who's gotten vaccinated, I think many of us who've been felt this, there's the minor effects are really sore arm for almost everybody. And then achiness and fatigue for about 24 hours that starts usually about 12 to 36 hours after the vaccine. There is a percentage of people who get a low-grade fever and can even have some shaking chills and a little bit of an upset stomach during that time as well. But what we've been hearing consistently from patients is that that goes away after about 24 hours of those symptoms. So those are the minor ones.
Thank you, Dr. Boxler. Really appreciate that. I know a lot of people do have some fear and concerns. I know that there's been some misinformation out there in the social media, and so that's really reassuring based on your real world experience. I'd like the next question to go to Dr. Adams, if possible. And this is a question related to advice that you might give to a woman who is pregnant, and what guidance are we giving individuals who are pregnant about receiving the vaccine?
So there has not been a clinical trial at this point in time with these vaccines, and so it's a little different discussion potentially. And the recommendation now is that each pregnant woman have that discussion with her provider during her pregnancy. It's a very individual decision. I know women have decided to proceed with it. There have not been any specific dangers brought up in terms of other impacts, but since we don't have even the initial trials that we have with other adults, there's less information on which to base that decision. It sounds like a non-answer, again, because we don't have data to back it up.
So that's a very good answer, Dr. Adams. I don't see that as a non-answer, but it definitely is one of those more challenging parts of how we manage this disease at this time. What I'd like to do is to perhaps have the next question addressed by Erica Lautenbach from the health department, and maybe to give some insight, maybe a peek into your crystal ball about how we might expect vaccine supplies to be administered through the state, what we might see in terms of allocations to Whatcom County, even though there's a tremendous amount of uncertainty. What are some things or some strategies or ideas that you're looking at to perhaps get the attention of the state to provide as much vaccine as available to Whatcom County?
Thanks for that, Chuck. You know, it is a bit of a crystal ball, and what we've known ever since this whole began about a year ago is the only thing we can count on is the uncertainty. And certainly, as you and other providers know, we're learning about vaccine allocation by county each week. So the planning process makes that very challenging for all of you, and certainly for us as a health department to be able to prognosticate what might be coming. We do see that there continues to be less supply than we had hoped, and certainly now that there are more than 42,000 people newly eligible to receive the vaccine, we now just have longer lines and more people eligible. We are working closely with the state, as are other counties, to make sure that the needs of our constituents are known, and that the vaccine is distributed as equitably as possible. There are some counties in Washington state that are through the 1A. Many of them are very small counties that received enough vaccine to vaccinate those 1A healthcare worker populations. There are others like Whatcom County and many other counties around the state that are not there yet because we have not had the supply. So we are doing our best to be patient. We urge patience from residents of Whatcom County, and we certainly have many conversations over the course of the week with the state and really trying to understand when and how the supply will begin to start opening up. We do recognize that there's new urgency with a new federal administration, and that could potentially lead to more vaccine. But at this point, again, the only certainty is uncertainty, unfortunately. I know that makes it very hard for all of our planning efforts and hard to assure and reassure our residents that it is coming soon, because we just don't know.
Thank you. The one thing that I would like to talk about with respect to planning efforts is the question around is if there is this shortage and there is this uncertainty around the vaccine supply, is there a risk that someone, after they receive their first dose, might miss their second dose as the result of a supply disruption? And I'll just speak on behalf of Peace Health for a moment. Our objective is to try to manage the first and second doses internally to the best of our ability. We are working on a daily basis to look at our allocations. So not only do what we have on hand, what we have scheduled next, as well as what we anticipate to be our next shipment. We always try to maintain a little buffer or safety cushion in order to ensure that second dose. I'm hopeful that as the state increases additional resources towards planning and getting vaccine out more effectively, and hopefully with support from the federal government, that we won't have those types of disruptions. But I heard Dr. Boxler speak earlier today about the what if. And if I might ask Dr. Boxler to share with the group the understanding that what if there is, for some reason, a miss of the second dose. And sometimes this happens because people have travel plan disruptions, they have other things that are beyond their control that may not make them available precisely at that second dose interval. And Dr. Boxler, if you could just address that question really quickly, I'd appreciate it.
Sure. The issue really is twofold. One is that we are really making every effort to get people vaccinated for their second dose within a fairly tight window so that we can get people fully vaccinated and protected as quickly as we possibly can. If supply or other things come up and there is a delay, we do not have to restart the series. If somebody, for instance, is supposed to come in 4 weeks after their first dose, but they can't make it till 6 weeks or 8 weeks, they will just get their second dose at that time. And we are actually pretty confident from a clinical standpoint, knowing how our immune system and vaccines work, that they will be as well protected at that time as they are if they'd come in at that 4-week mark. So I want to reassure people they don't have to be in on that exact day, but they do have to wait at least to a time period within, for Pfizer, for instance, is supposed to be 3 weeks or 21 days. You cannot get the second dose before 17 days. And for Moderna, there's a 4-day window before the 28-day mark. So you have to be at least that long out, but after that, all of our experience with other childhood vaccines, which I'm very experienced with, show that if you're beyond that mark, you still get equally good protection. So I think that's what you're getting at, is for people not to worry too much. Get that first shot, get that second shot scheduled, get it as quickly as you can within those windows. But if something comes up and you're delayed, don't worry, just get it when you can.
Thank you very much, Dr. Boxler. So what I'd like to do is just offer to each of our panelists this afternoon just a quick closing comment to really just any key messages you'd like to have our participants take away from our conversation today. Dr. Adams, if I might ask you to go next, then Dr. Hopper, then Dr. Boxler, and then Erica.
I would just like to reassure people that I think we're fortunate in Whatcom County that we have the degree of collaboration and sharing that we do, and we are all very committed to vaccinating everyone in a timely fashion and as quickly as possible. Hopefully we can start to count on a more reliable vaccine supply in the near future so that we can confidently administer every vaccine that comes in the door as quickly as possible and have another shipment of vaccine en route. That is our goal, and I think a realistic expectation in the very near future. And sooner we can do that, the better off for all of us. So we appreciate everyone's patience and understanding as we do this. At the same time, we are providing the ongoing care both in our clinics and offices in our hospital, as we have always done. So keep the faith, and we will do the very best we can. Thank
you. Okay. So I would echo what Ione is saying. Each of us has been in meetings with the rest of us multiple times over the past several weeks, making sure that we're providing this vaccine collaboratively. There's nothing in Whatcom County that is one organization against another to try and get their own patients vaccine. At FCN, we're committed to getting our patients vaccine, but working together with the others to figure out how to get those people who may not have a primary care physician vaccine. I do commend the FCN members on their patience and recommend going to our website, using the website for your information. We will have information there sooner than even your own physician in your primary care office has information. So get it on the website first, and we will get you vaccinated as soon as we possibly can. I think I just look forward to continuing to work with Ione and Jim and the health department as we get even bigger projects going. Thank you.
Right, and I'll just add very shortly to that, Chuck, that Peace Health Medical Group is really planning on trying to vaccinate a very large number of people. We are very practically trying to set up a system that we can get people in an orderly manner. And that's why we are starting with the people that we know best. That does not mean that we are not working directly with the health department and our other people in the community to address everybody's needs to get vaccinated. And the other thing I'd just like to stress is that this is going to take a long time. And I know we said it before, but we are all going to have to try and avoid that COVID fatigue that we all have and continue to do the things that we've been doing since March, which is wearing masks, socially distancing, and washing our hands, and just being careful that we don't pass this virus to others as we're rolling this vaccine out, because it's going to be a long process.
Thanks. You all said this so well. I don't really have much to add other than myself and my colleagues at the health department are incredibly appreciative of the partnership and collaboration our providers and our enrolled providers have shown, the many meetings, planning, really approaching this as a team effort, setting aside individual businesses and entities and really thinking about this. How do we make sure that our community is supported and vaccinated as soon as possible? And doing planning around our vulnerable populations, some of our harder to reach populations, thinking about how do we create different models to ensure that we can vaccinate people quickly and readily. So I just want to share my thanks with all of you for the incredible partnership that you've shown. I think we're well positioned once there is vaccine supply to be able to administer it quickly and safely to our community.
So thank you all. I think it's really fitting, as Erica described earlier, that this is the 1-year anniversary of the first recognized case in Washington State. And I wish I said we had planned it that way, but it really is just a happy coincidence. I am so grateful for every one of our panel participants today. I know that we will get there. We will ultimately meet the needs of Whatcom County. And as soon as more vaccine supply arrives, we are eager to work tirelessly to meet that demand. So I want to thank you all for those who participated today, and wish you just to be well, continue to stay safe, follow the social distancing and other safe practice guidelines to prevent COVID, and we'll get through this together. Thank you.